The medial and lateral menisci are fibrocatilaginous structures located in the tibial plateau and attached to this bone by the coronary ligaments. The movements of the knee are flexion and extension in the sagittal plane, however, as mentioned earlier, when the knee is in some rotation is possible. They are performed by 12 muscles. The muscles of the ischiotibial group or hock are the semitendinosus, the semimembranaceous and the biceps femoris that perform knee flexion. The first two also respond to medial tibial rotation when the knee is partially flexed in open chain. With the chain closed, that is, in a weight-bearing situation, they rotate the femur laterally in relation to the tibia. The muscles of this group are innervated by the ischial nerve. The extension of the knee is performed by the quadriceps, which is composed of the vastus lateralis, vastus medialis, vastus intermedius and rectus femoris, which also acts in hip flexion and is innervated by the femoral nerve. There are studies that indicate that the vastus medialis has a stabilizing function on the patellofemoral joint. Other muscles that act on the knee joint are the sartorius, which is the longest muscle in the body and acts as a hip flexor, but because it crosses the knee it presents action as a medial rotator of the tibia with the joint in flexion. It is innervated by the femoral nerve. Its tendon, together with the tendon of the gluteus and the semitendinaceous, form a structure called the goosefoot. The gracilis is a quadriceps adductor that acts as a secondary flexor of the knee and also supports the internal rotator function of the tibia when the knee is in flexion. It is innervated by the obturator nerve. The tensor fascia lata acts to stabilize the knee in extension. Superior gluteal nerve. The popliteus is a small muscle located at the posterior of the knee and acts at the beginning of flexion in unlocking the joint. Tibial nerve. The calf muscles, the medial and lateral gastrocnemius, have a primary action in plantar flexion of the ankle joint, but because they cross the eye, they have some flexor action on this joint. Tibial nerve. Kinesiology of the ankle. Tibiotarsal articulation. What is referred to as the joint between the tibia and the tarsal bones is actually a set of three joints: the talus tibialis, the subtalar or talus calcaneus joint, calcaneal joint, and the transverse tarsal joint, also called the mediatarsal joint. Mediatarsal joint. Although anatomically separate, they act together in performing some movements. The bones that participate in these joints are the distal tibia, the talus, the calcaneus, the navicular, cuboid, the three cuneiforms and the fibula, which is of fundamental importance for the stability of the set. The talatibial joint between the tibia and talus, which is the most proximal of the tarsal bones, is considered by the talatibial joint between the tibia and talus, which is the most proximal of the tarsal bones, is considered by Lippard, 1996, as the true ankle joint. In this joint the tibia and fibula form a socket to the talus and the only possible movements are flexion, between 30 and 50, and extension, 20, that occur in the sagittal plane. Using the plantar region as a reference, these movements are called plantar flexion or plantar extension. If the reference is to the dorsal region of the foot, it will be called dorsiflexion or dorsal extension. The subtalar joint is formed by the lower surface of the talus, convex, and the upper surface of the calcaneus, concave, that allows the inversion and eversion movements of the calcaneus. It cannot be separated functionally from the transverse tarsal joint, which is formed by the anterior surfaces of the talus and calcaneus and the posterior surfaces of the posterior navicular and cuboid bones. Together they perform abduction, adduction, pronation and supination of the foot ligaments and other structures. The tibiotarsal joint is synovial, reinforced by ligaments which are actually groups of ligaments. Medially there is the deltoid ligament that connects the medial malleolus to the talus, navicular and calcaneus. The anterior fibers attached to the navicular originate the tibionavicular ligament. The medial fibers attached to the talus and calcaneus form the tibio-calcaneal ligament, and the posterior fibers will attach behind the talus, forming the posterior tibiotalar ligament. Tibiotalar posterior ligament. There is also a group of deep fibers that give rise to the anterior tibiotalar ligament. In the lateral region is the lateral ligament, which is actually a group formed by three ligaments: the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneal fibular ligament. Calcaneal fibular ligament. Another structure involved in the stability of this segment is the distal portion of the interosseous membrane.